Diversity is important in every industry, and here is why. Our human population is diverse, and especially when you are serving people in the sphere of healthcare, you have to be able to relate and recognize any issue or any opportunity that will enhance your care of a patient. So as laboratory professionals and physicians, it is our obligation to make sure that our workforce represents the people we serve. That allows us to be aware of their needs. It allows us a touch point and a level of connectivity that otherwise would be absent.
When you have a diverse staff, you are getting a piece of, basically the piece of the pie from every perspective, and that's very important. By having that diverse staff, you are addressing things and concepts that you may not have thought of. And there's one thing to keep note that if everyone that you're sitting down at the table with looks like you, sounds like you, talks like you, thinks like you are missing something. And it's very vital to have that, those different perspectives to consider.
Diversity means that we are learning about the nuances of everything, perceptions, cultural norms about getting screened for cancer, for example, and just providing a full understanding of humanity. And so it broadens our horizons instead of giving us a one-size-fit-all myopic view of the way that the world operates. And that's really key in really getting good patient outcomes across the spectrum of the members of our society.
To go where they are. So if you want to recruit people of diverse backgrounds, you have to go where people of diverse backgrounds are. If you want to recruit more African Americans, go to historically black colleges and universities. If you want to recruit people that have military experience, then you need to be in those areas in which there are military personnel. If you want to recruit people that have had experience in rural communities, then you need to go in those areas. You're probably thinking, well, we can't physically go in all of those areas. Well, that's the beauty of technology, so that you're able to meet people where they are. So utilizing platforms such as LinkedIn or Twitter, Instagram, could be X today, or it could be TikTok, depending on where you are, but you have to meet people where they work and where they live. And I think that's a great strategy for being able to recruit that diverse workforce, of using technology, but also positioning yourself in where people are.
We need to get to the community level, and so doing things that I do, which is going to high schools in my local community that is primarily members of the class, if you will, are from underserved communities. So going directly into the community and almost having one-on-one conversation, and also hitting schools such as historically black colleges or universities, but being very, very targeted in doing, we all have so much to do in each day, but if we all say, you know, maybe twice a year I'm just going to visit my local high school, or be strategic in just having conversations with a group of junior high schoolers or high schoolers about who we are and what we do.
Mentoring opportunities are wonderful. I was assigned a mentee and very happy to do that because I had mentors that helped me throughout this process. And I know that there are so many organizations, including ASCP and Society of Black Pathologists, that are actively working on mentorship opportunities, because that's the way you're going to reach the underserved. The common consensus is it's too expensive to go to medical school. It's too expensive to try to do some of these professional specialties. Whereas we are saying that there is always a way, and if you have a good mentor to map out a road for you, you can find that way and be successful. That is something that has to be very intentional. People may have skills and gifts that help them stand out as leaders compared to others, but the reality is leaders are not born, they're groomed. it's best to have a program in place internally where you can move people up the ladder. And that should be solely based on their performance and their drive and their care for our communities.
Visibility is key of having those people. What is the pathway? Is there a published career track to get somebody into a management role? So if I'm a scientist on the bench and I do desire to be a laboratory administrator, a manager, how do I get there? Besides what I think, how do I get there? Does your organization have a succession plan? So is there a succession plan or management track where you are stating that we want people that be managers, have this degree, have this amount of experience, we will give you X amount of years of mentoring or coaching. So having that published pathway of being able to get into a management role, I think that's how you increase the diversity, how you increase the leadership.